everyone. My name is Sarah and I'm a pediatric occupational therapist and part of the infant development team here at Emerge Pediatric Therapy, and I'm here today to talk to you about infant feeding. Now, infant feeding is a very popular topic. It's something we see talked about a lot on Facebook. There's a lot of books and resources out there for parents, and I know that sometimes it can be overwhelming to navigate all of that information. So my hope is today that I can go over some of the popular feeding approaches and give my recommendations of when to begin your baby on solid feeds and how to support their natural development through feeding. So the first thing I'm going to talk today about is baby-led weaning. And this was actually a term that was coined 10 years ago by a British midwife. And this approach has gained a lot of popularity in the last few years. And the basic premise of baby-led weaning is that you start at 6 months of age when the child is able to sit independently and grasp food on their own, and they start with feeding themselves finger foods. So the basic premise of this approach is that the infant eats the same foods that the parents and other children eat at the table, and they're fully incorporated into the mealtime. Baby-led weaning does not incorporate any purees or spoon feeding. Another approach I want to talk about is baby self-feeding, and this approach recognizes the importance of purees from a developmental standpoint and how they can help children initially learn how to chew and swallow. And I really like this approach because it incorporates bits and pieces from a lot of feeding approaches, so it does both purees and table foods and works through the continuing of development with the infant. Another reason why I like baby self-feeding is that it allows for variety, and a lot of what we know about infant feeding is that the more variety a child is introduced to earlier in life, the more likely they are to accept a variety of taste and textures later on. Variety is also essential for developing adventurous eaters, and that's something that we really want to start promoting as soon as an infant begins with solid feeds. There is actually a sweet spot for the introduction of a variety of taste and textures, and a lot of research says that between that 6 and 12 month mark, we can make a difference in the preferences kids have for foods later in life. So that's why it's really important to introduce those fruits and vegetables, because you can impact your child's food preferences later with what you introduce in that critical period between 6 to 12 months. Another thing to keep in mind is that puree foods don't always taste and feel like the food does cooked a different way. So for instance, if we're talking about pureed apples, they tend to be smoother, a little bit more sugary, a little bit more bland taste than if we kind of had an apple that we bought at the store and cooked up for the child. So the important thing is to introduce purees, but also keep in mind that those tastes are not quite the same as what the actual food tastes like later in life. So using purees for a short period of time, but not staying on them for too long, as kids will develop a preference for that sugary, bland processed taste, when in reality we want them to be used to a lot of different tastes and flavors later in life. Another important thing to note is that you want to continue offering foods even if your child seems to not like them. And this can be really hard with babies because a lot of times when you first give them a new food such as a puree, they might spit it out or even grimace. This doesn't necessarily mean that the infant doesn't like the food. A lot of times they're still learning what food feels like in their mouth and how to control it, and that initial response is just them getting used to the new food. A lot of research states that you should offer a food 6 to 15 times for your infant to even accept it. That doesn't even mean that they'll have a preference for it, that's just for them to accept it. So if you offer your infant a food and they don't like it, take a break for a few days and then try offering it again. It's important that we give infants multiple tries with these foods to see if they're able to develop a preference for it. Another important thing to discuss is meal times in general. There's actually a lot of research that infants and young children that engage in family meal times at least 1 to 2 times a week have an increase in the amount of produce they eat later in life. It's really important for the minute your child starts solid feeds to incorporate them into mealtime and make them an active participant. Infants being an active participant in mealtime helps with their brain development and the development of fine motor skills. Now that we have gone over the different approaches to feeding, a little bit about the development of feeding skills, and also the importance of mealtime, we're now going to discuss the best time to introduce your infant to solid foods. Most pediatricians recommend 6 months of age for the first introduction of solid foods, and this is because the World Health Organization and the American Academy of Pediatrics recommend exclusively breast or bottle feeding until 6 months of age. Infants that are introduced to solids before 6 months of age might not have the oral motor, gross motor, or fine motor skills to successfully participate in feeding. Infants below 6 months of age are also getting all their necessary nutrients from their breast or bottle feeding, and they don't necessarily need the added nutrients of food at that age. Around that 6-month mark is when infants need an increase in their iron intake, and that is typically something infants are able to get through the introduction of other foods. There might be some cases where you can introduce your infant to solid foods earlier, but I recommend talking to your pediatrician to see if this is right for your infant and their timeline. There are a few important things to keep in mind when you start solid foods with your infant. In the first few months of solid feeds, infants aren't going to get a lot of nutrition from their foods. There's going to be a lot that ends up on their hands, on their faces, and on the table, and not necessarily in their mouth. So it's important for at least those first few months to continue their breast and bottle feeds, but we also look at introduced solid feeds about 2 times a day. And this is something that you can really look at your daily routine and see when it might be best to sit down and have a meal with your infant. Some families prefer breakfast and dinner or lunch and dinner. It really just depends on your schedule and what times of day are best for you to sit down with your infant. We recommend not offering the breast or bottle at the same time as the solid feed, but we also don't want your infant to be too hungry when they sit down for their solid feed and get frustrated during the process. So you can offer your infant breast or bottle 30 to 60 minutes before the solid feed, and that will help them not be too hungry when they sit down for their solids, but hungry enough that they're still willing to engage with the food. At around 8 to 9 months of age, infants typically start dropping some of their breast or bottle feeds as they start to get more nutrition from their pureed and solid food feeds. Like I said earlier, purees are very important from a developmental perspective for infants' feeding development. Purees really teach an infant how to safely swallow foods, which is a precursor for being able to chew and swallow other foods. Infants are also less likely to gag or choke on purees, so they can truly learn to safely swallow before foods that are a little bit trickier are introduced to them. Once a baby is comfortable swallowing purees, you can start to introduce soft table foods. And this typically happens around 7 months of age, so you'll continue those purees for the first few weeks, then introduce solids, and you'll continue to sporadically incorporate those purees so infants still are used to the taste and the texture of the pureed foods. But around 7 months of age, if your infant is showing good core strength to sit, they show good hand and eye coordination, and they're able to successfully swallow purees, then they're probably ready for some soft table foods. The exciting thing about infant feeding is how engaged a lot of infants get. Infants typically like to explore purees not only with their mouth, but also with their eyes and their hands, and all of the different textures. It is totally okay to let infants get messy while they're learning their first feeding skills. A lot of times this is another sense that infants use to understand the properties of the foods and how it might feel and taste in their mouth. Another important thing with early feeds is to start to set up that family mealtime routine. And like we talked about earlier, there are a lot of benefits to sitting down and having a meal together as a family. And these habits started with the first solid feed for the infant can integrate it more into your daily routine. I hope that this information has been helpful in guiding you a little bit of when to start your infant on solid foods and what foods to start first. Any questions about the information I went over today, or if your infant is having difficulty transitioning to pureed foods or to table foods, please feel free to reach out via email or give us a call, and I'll be more than happy to answer any of your questions regarding infant feeding. Thanks so much.